The topic that I'm speaking on today is grief care and bereavement. This is certainly an issue that affects us all, from children losing parents or grandparents, parents losing their parents, and then of course, older people losing their friends as we move along in our lifespan. And what I first want to talk about a little bit is the stages of grief, just to kind of educate you about the stages that we go through. And the important thing to remember is that we all go through them at different times. There's no, it's been 2 months on one stage and another month on another stage. And you can also go back and forth between stages. It all depends on the individual and what's going on. The first stage of grief is shock, when you're just in absolute shock that someone has passed away or you've lost a loved one. The second stage is denial, denying that this has happened. This can't be real. This can't be happening to me right now. And the third stage is anger, being really angry that you lost a loved one. And the fourth stage is bargaining, setting terms or, trying to figure out a way to come to terms with this. Like if, I'll bargain that, if I give this, I'll be able to move on. And then finally, acceptance, just accepting the loss and kind of reintegrating your life and moving along. Usually, grieving can last from 6 months to a year, but if it lingers beyond that, that might be the point where you want professional help. They do have professional help centers for children in San Antonio. There are also, opportunities with psychologists and counselors, or considering taking medication to get through the loss. The real issue is how much it's interfering with your daily function, your ability to work, take care of your family, your social relationships, going through the loss. I used to work when I worked at the VA, I was on the palliative care service, which meant people were basically there for the last 6 months of their life. Just to be palliated and to be more comfortable as far as pain management, and I noticed that the widows or a lot of the family members that were losing somebody really needed more support, and then of course the follow-up care just to kind of check in as they go through the stages of grief that I mentioned, and another piece of grief that can be particularly debilitating is caregiver stress that happens before the loss. If you have an older family member who, is in a nursing home or is at home, but just for a long time, the prolonged care, that can take a lot of stress and a lot of wear and tear on the caregiver, so they don't have a lot, of energy left to grieve, after they've lost the loved one. So I certainly, in those instances, I recommend, reaching out to others, seeking social support from family and friends, staying involved in the community with, church activities or community activities, but avoiding isolation. And when you have the opportunity to be in community or social activity, you don't have to talk about, if you need to talk about your grieving, you can do that, or if you would like to focus on something else, that's certainly helpful too. Going through the stages of grief, and then getting proper nutrition, taking good care of yourself, your body, diet and exercise, stress management, taking some time out, particularly with the caregiver stress, going through, taking care of someone, when they're dying, until they're more comfortable. It's especially important. And another aspect of grief is how we speak to children about it, if they're losing a parent or a grandparent, because they don't quite understand things as well as adults too. But just being really honest with them, about what's happening, or giving them a chance to say goodbye, to their grandmother. And there are some children's books out specifically on this topic, which are helpful to kind of, put the pieces back together. And once you've kind of gone through the stages of grief that I mentioned, the shock and the denial and the anger and the bargaining and the acceptance, then you kind of put your, reintegrate your life, or, on. A little bit more about the types of grief. People do grieve in different ways. You know, some people don't cry. Some people cry every day for 6 months. Some people, it doesn't hit them for a year. Some people need to talk about it. Some people don't want to talk about it at all, or they, you know, lose themselves in work or exercise or some other activity. Some people are more prone to substance abuse, you know, as a way of dealing with the pain, the emotional pain, or falling into bad habits. So those are kind of red flags to look out for, you know, as far as intervention and, you know, keeping them from going down a path like that. Again, seeking professional help can be helpful.